A very good evening to all the doctors. Welcome to this session of discussion of 25 most important questions from micro. So as you know, this is a session where we will be hammering the most important, points as such. It's not going to be just the questions. We will learn the points in and around what you need to know around these topics. So I hope everybody have joined in already. So let us begin our session now. What I'll be doing is I'll be giving you some time, roughly around 30 to 40 seconds, where you need to, read the question and choose the answers for yourself. And then we will discuss the answers just following that. Okay. So for the first question, your time starts now. As you can see, there is a 22-year-old male who is brought to the hospital due to the fever, frontal headache, photophobia, nausea, and anorexia. Physical exam shows positivity to the Brudzinski sign. Lumbar puncture was done and the CSF analysis shows increase in the opening pressure, normal protein and glucose. Leukocyte count is given to you. What is the most likely organism implicated in causing the above condition? So what I see, majority of you are answering it as B, Neisseria meningitidis. Okay. Now let me give you the correct answer here, guys. The correct answer to this question, it is actually enteroviruses. Okay. Now that's the thing. We want to make a mistake here right now, learn so that we can actually answer this correctly in the examination. That's the whole purpose of this. Okay. So enteroviruses basically is the correct answer here. So first of all, let's learn a couple of points. The first point is, overall, if you talk about meningitis, who actually causes this disease more commonly? The answer is bacteria cause the meningitis more common than the viruses. Okay, so the bacterial meningitis is actually more common than the viral meningitis. Now, if I say bacterial meningitis, who is the most common agent to do that? You should all know bacterial meningitis, the most common agent is Streptococcus pneumoniae and it is not Neisseria. Okay. I'm not denying that, Neisseria doesn't cause meningitis. Yes, it does cause meningitis, but overall the most common agent for meningitis would be Streptococcus pneumoniae, right? So that is one fact that we have laid down. So it causes meningitis in everybody except for the neonates. And in the neonates, the most common agents causing the meningitis is Enterobacteriaceae members like Klebsiella, E. coli, etc. Okay, so that's about it. Neonatal meningitis, the answer is Enterobacteriaceae, especially Klebsiella. Whereas for the other meningitis, it is Strep pneumo. So that fact is over. Now the next thing is viral meningitis. When we talk about the most common agents for viral meningitis, it is enteroviruses, in fact more common than HSV2. See, we had learnt in our classes also that herpes simplex viruses 1 and 2, right? We remember them by this mnemonic above the waist and below the waist. So technically, when I say above the waist, HSV1 should have caused meningitis, but it is an exception. HSV2 causes the meningitis more common than the 1. In fact, there was a name for this, as you know, called as Mollaret's meningitis. Mollaret's meningitis, it is actually more common by the number 2 rather than 1. This is one exception you should know. Baki everything else, HSV1 causes above the waist, right? So this is the first thing. Meningitis, if you talk about, you should say enteroviruses are the most common cause. Now, the next thing what we should discuss here is, it is encephalitis. You know, when the brain gets involved, we call it as the encephalitis. And when we say encephalitis, we should know that HSV1 is more common than 2. It goes by the rule above the waist, except for Mollaret's meningitis. and the catchword or the buzzword to pick up the herpes encephalitis, they would definitely mention temporal lobe involvement, right? So you should all know when HSV1 causes the encephalitis, it is going to be the temporal lobe. So all these words what I said, so HSV1 will become the most common cause of sporadic encephalitis. Okay, the most common cause of sporadic encephalitis, it is going to be this agent. So for now, I have just discussed, some agents causing the problem. Now, if you talk about the clinical presentations, bacterial meningitis is more severe compared to the viral one. Viral one comparatively has a better prognosis in comparison to bacterial meningitis. Okay. So why was the answer as enteroviruses? This is what we are going to look at. So guys, this is basically the CSF analysis. When we do the lumbar puncture, collect the CSF sample, we are just saying like what are the things that you need to know as such. So first of all, the bacterial meningitis, we will name it as pyogenic meningitis. Okay. So let's just compare the main two as of now, viral versus pyogenic, although I have put the tubercular meningitis also in between. ठीक है. See, viral, the presentation is mild and even there will not be much changes as such in the CSF. ठीक है, in relation to the pyogenic meningitis. Let's start here. Pyogenic meningitis, as you see, has very high opening pressure. Okay. In comparison, yes, it is high, but not as high as bacterial meningitis. Next, the proteins that are present in that CSF, they would be again very high when it comes to this thing, and they are normal more or less. Now the difference comes, if you see the WBC count, since it's more serious, let's just think more WBCs are going to that place, and relatively it's very less WBCs. And bacterial meningitis may neutrophils will migrate, whereas in the viral and the tubercular etc., it would be lymphocytes. Okay. Now one of the most important things that you should memorize by this line, bacteria love glucose. Okay, bacteria love glucose. So technically glucose would be very less in the pyogenic meningitis. It will definitely lower the glucose. So Abhi, let's go back to the question and revisit these points. Have a look. How was the glucose proteins mentioned? Normal. Opening pressure, yes, it is high, but I can't say by 1 arrow, 2 arrow like that in exam. But look at the protein glucose, they were normal. Next, they said leukocyte count is just around 200, whereas in the bacterial one, it has to be very high. So that's the reason it cannot be the bacterial meningitis. It is the viral meningitis. And who's the most common cause of viral meningitis, doctors? It is enterovirus. So that would be the correct answer here. All right. I hope everybody followed that. Next, let us move to the second question right now. So your time begins right here. Electron microscopic picture of an organism is given below. What is the best test for the diagnosis of this organism? Okay, so I hope you're ready with your answers over here. One of the important things to answer this question is you would have to identify which virus is this. Okay, so this is the guy. When I said electron microscope, you should know it is most probably a virus. Because we all know one thing, viruses are too small. That's why we need to use a microscope with more zooming capability like electron microscope. So it's a virus. Now, if you give a rough outline to this virus, it is described as bullet-shaped virus. Okay, this would be described as the bullet-shaped virus. And we know the bullet-shaped virus name, it is given to the rabies virus. So whatever the special shapes are, for example, astrovirus is star-shaped, rotavirus is wheel-shaped. So these ones you should be familiar with first of all. So now you might have identified this guy is the rabies virus. So in other words, I'm asking you now for the rabies virus, which amongst this is the best test? Okay. See, One thing we should first understand is when we want to diagnose rabies, we should first divide it into two things: ante-mortem diagnosis of rabies versus post-mortem. See, if somebody died of rabies, that means you're doing the autopsy. What I can do is I can take a sample from the brain which will contains Negri bodies. Negri bodies are helpful in the diagnosis of post-mortem, diagnosis, and we use something called as Seller's stain. I repeat the name, it is going to be Seller's stain for the post-mortem diagnosis. Next, when we talk ante-mortem diagnosis, we will collect hair samples from the back of the neck called as nape of neck. So ante-mortem diagnosis is done by collecting the hair follicles from here, and also we can collect the corneal scrapings. Once we have collected the samples, what we are going to do is the best test called as DFAT. So what DFAT does is it utilizes some antibodies which can recognize the antigen. It can recognize the antigen of rabies. And the name of the antigen it recognizes from the patient's sample is nucleoprotein. Nucleoprotein antigen is identified by a test called as direct fluorescent antibody test. See, just because the antibody is in the name of the test, don't assume we are detecting antibody. We are detecting the antigen by using antibodies, right? Now, although this kind of a situation should not be given in examination, but let me just clear out one thing to you. If we have to go with, the test, PCR also becomes a very good option for the diagnosis. As a matter of fact, as we know, majority of the viruses, a very great test is PCR, right? So PCR would also be equally good as DFAT test. DFAT stands for direct fluorescent antibody test. Okay, and let's say worse come worse, if we have to choose one thing, then we will go to PCR over the DFAT. Although, as I said, that situation should not come in exam. It should be one answer only. Most probably, if they're asking you, since PCR can be easily picked by anyone, I think they will ask you DFAT. Okay, is that understood by all? Because we know RT-PCR, etc. have become so common in this age. We know it's a very high level test. It's a great test for confirmation of viruses. So this finishes your next question about rabies. DFAT is the test that is the best of all in this scenario. Okay. Next. The next scenario is here. What we are saying in which of these phases of bacterial growth curve, bacteria generally attains maximum size. Okay. So you have some time to think and answer this. In which of the bacterial growth phases I am saying bacteria generally attains maximum size. All right. Since you're giving the answers already, majority of you are giving correct. Let us just check out this thing right now. What is the correct answer to this? So I'm just looking at your answers. Chaliye dosto, let us discuss this scenario right now. Okay, so first of all, what I would like all of you to know is, from the moment we inoculate a bacteria onto a culture media, they will show a pattern of growth, what we see in something called as bacterial growth curve. Now remember, in comparison to the human body versus the culture media, nutrition is in both places, but they have limited nutrition in culture media. Okay, so something will happen here. Initially, when we have inoculated the bacteria like this, they don't reproduce. The time between the inoculation until the multiplication of the bacteria, it is called by the name of lag phase. This is the first thing. Now in the lag phase, the bacteria are getting ready to reproduce. And since they are getting ready, what happens in them is the enzymes, etc., they are going to increase. So basically, in the lag phase, what I'm saying right now, what happens is because increase in the enzymes or metabolites, etc., it leads to increase in size of the organism. So maximum size of the organism is seen at the lag phase. Lag is a lag, that means there is no reproduction. Now next what will start for them is sudden there will be increase in the count of the bacteria. So this increase in the number of bacteria, it is called by the name of log phase. Now because they are constantly reproducing, they are using biochemical reactions, etc., now their size will decrease. See, the things that they accumulated is now getting used up. So now the size will decrease in the log phase. And next what else will happen is, this is the phase, since they are having abundance of enzymes, etc., what they are utilizing, this is the best phase to do biochemical reaction as well as the gram stain, right? So in the bacterial growth curve, this is the time when we can best do the biochemical reaction also as well as the gram stain. Now there comes a point where the nutrition is getting exhausted now. So the third phase will begin now. This third phase is simply known as stationary phase. Now in the stationary phase, what ends up happening is, if you talk about the bacteria, live bacteria, that means the ones which are getting born right now, okay, is almost equivalent to the bacteria that are dying. So birth equal death over here. That's the reason there is no net increase in the living bacteria. There is no net increase as such. So kya ho raha hai? Here's where it looks stationary. And last and the final is, since all nutrition is exhausted right now, all the bacteria starts to die, and this is known as the death phase. So technically this is the sequence how the bacterial growth curve goes. Please know, lag, log, stationary and death. This itself could be one MCQ, arranging it in the proper sequence. Now if you see here, in the stationary phase, some bacteria are surviving, some are dying, right? Whereas in the death phase, everybody is dying. So if you talk about unfair scenario here, it is the stationary. Because in the death phase, you can't complain, everybody is dying here. Stationary is the one in which the situation is not fair. And in this scenario, when the conditions are unfair for the bacteria, you can remember they start to form spores. So spore formation, toxin formation, etc., it takes place in the stationary phase. So this is all that you need to know as such when it comes to this question called as bacterial growth curve. And since they asked in which of the scenario it is going to increase the size, the answer is going to be lag phase. Hopefully, you guys got it correct. So that was your next question. Let's move to this one now. So you can just have a look at this. The culture media shown in the image is an example of what kind of culture media is shown in this picture. Chaliye. Now, this is more or less a straightforward question. You need to identify what culture media it is. See, there are not a lot of culture medias that you need to by heart as such. Like whatever the few that are important, I had told you to memorize. So, when you see this, you should know that this is a culture media by the name of TCBS. And TCBS is a culture media for the organism called as Vibrio cholera. Vibrio cholera, for this organism, this is the culture media. Now, when I'm so specifically saying that this is a culture media for Vibrio cholera, not for any other organism, that means it is selective media. Selective media is for one kind of a organism, right? So, एक बार revise कर लेते हैं. See, culture media, what you should first know, all culture medias will contain proteins for the growth of the organisms. Digested proteins are present as a nutrition for the bacteria. Next, once you have taken this, what we need to do is we need to solidify this culture media, for which we need to add something called by the name of agar. Agar needs to be added. So simply put, the agar solidifies this media. The more agar you add, the more solid it will become. The less you will add, the less solid it will become. So you need to know 3 percentages that we tend to use. One is 0.5% doctors. second is 2%, and the third is 6%. So of course, by logic, 6% is the most solid, 0.5% is the least solid. Assume this, you want the bacteria to swim, meaning you want the bacteria to show their motilities. You can't make the media too solid. They can't show motility then. You have to keep it a bit liquidy, yes or no? That's why if you want to show motility of an organism, you need to use which percentage? 0.5%. Whereas if you want to suppress something called as swarming, right? If you want to suppress the swarming of some organisms, you need to use high level of agar, that is 6%. Whereas in general, the most common one that can be used is 2%. So pure micro type of questions when they ask you. Let's just recap these things just before exam. The more solid, the organisms cannot swim, and that is the 6%. The less solid, that is 0.5%. This is for demonstrating the motility. Okay. Motility ke liye, we have also learned one special thing, hanging drop method. So there's a slide which has a depression in the center where there is space for the organisms to show their motility. Hanging drop method also, that is important for motility. Chaliye, so this I just said how is a culture media made. Simple media contains simple nutrition, and not every bacteria can grow on that. So it's a simple media, simple organisms who don't want anything special can grow on that. Now to the simple media, when we add some ingredients, for example blood or egg or serum, these are the three things right now what I'm saying. Blood, egg or serum, when you add, it's called as enriched media. Okay, so when you add this extra nutrients, a lot of bacteria likes to grow on that. That means enrichment media can be for the enriched media can be for a lot of organisms. With blood, we get two agars, you may know. If the blood is not hemolyzed or unhemolyzed, we simply call it as blood agar. Whereas if the blood is hemolyzed, when the RBCs are broken down in that, that's called as chocolate agar. Chocolate agar is not chocolate, it is just a blood agar. Okay, for example, serum, one in diphtheria you should be knowing is Loeffler serum slope, right? Loeffler serum slope is the one that we use in diphtheria, which allows faster growth of diphtheria. Okay, so that's about it. This is the question, the answer to which was selective media. All right, now let us go to the next question as such. The question is organism that does not stain with gram stain except. So in other words, they're asking which of the guys stains with gram stain. Three organisms do not stain with gram stain except one. Okay, so let's go ahead, discuss about this question. Hopefully you are all ready with your answer. The guy that doesn't stain with gram stain are all of the organisms in the list except, meaning who stains with the gram stain. That's what they're asking. So the answer for this one's okay, let me reiterate the question for you all. Guys, I'm saying that in this question, three options do not stain with gram stain. One guy stains with gram stain. So they are asking who stains with gram stain. Okay. So technically in this list, all of them does not stain with gram stain except one. That means who's staining with the gram stain. Okay. The answer to this comes down to Neisseria. Okay. The answer here is Neisseria. आप सबको पता होना चाहिए that the Neisseria organism, it is a gram-negative cocci. Okay, in fact, we know it as diplococci. It exists in pairs, right? There are two species, Neisseria gonorrhoeae and Neisseria meningitidis. Meningitidis, it's described as lens-shaped, whereas the gonorrhoeae are described like the kidney-shaped organism. So, gram-negative cocci. So, sabse pehle, only this guy can stain. Now, let's have a look at the other guys. Now, first of all, you should know, Mycoplasma, it does not have a cell wall. And when we do the gram stain, what exactly are we staining? We are staining the peptidoglycan layer which is present in the cell wall. So since it does not have, the cell wall, we can't gram stain. So this guy is out of the option. It doesn't gram stain. Chlamydia has some viral properties, right? Chlamydia has some viral properties, and for that reason, just like viruses, one of the best tests for chlamydia diagnosis again would be PCR or NAT, whatever you call it. So PCR is a better test for the chlamydia. So it has viral properties, and we can't gram stain the viruses. So it's not a very typical bacteria. Chlamydia, yes, it's classified as a bacteria, but it does have some viral properties. Okay, next, Treponema pallidum. It comes under the organisms we call as spirochetes, the one that can show this corkscrew motility we may know about, right? Now these spirochetes are called so because they are spiral in shape, and spiral organisms, obviously when they move, they will show that corkscrew motility. Now the story about these guys is they are very, very thin, right? These organisms are very, very thin, so it's very difficult to gram stain them. So what we generally do is, see, if you want to do the gram stain is again visualized on the light microscope. Generally, we will have to use the routine microscope, what we call as the light microscope. But on the light microscope, you need some color to easily see the organism. And I am saying that coloring stain called as gram stain cannot be done for this treponemes. That's why we might remember we use a special microscope for this guy, dark field microscope, right? This dark field microscope produces a very dark background, and against this dark background you can see the spiral organisms, right, in a white color. Dark field microscope. And one more thing, what we do for these treponemes, because they are very, very thin, to visualize them, we add one stain that will make them a bit thicker, and that is known as impregnation stain. Okay, this one would be known as the impregnation stain. Silver, etc. These are examples of impregnation, meaning they will just add a layer, assume it like that. They will just add a layer to this bacteria called treponema, because of which now they become more clearly visible. So I hope this question, is clear enough to everybody now. The other three organisms were not going to stain with the gram stain. The only one from this list was Neisseria. Okay, let's go. All right. So the question is, a 40-year-old male from a village presented to the hospital with complaints of fever and chills. Okay. He also informed that he has noticed dark stools recently. The physician performed a test, image of which is shown below. So it's a physical exam. The image shows the area just near the anterior cubital fossa where the changes are noticed, which is the most likely infection. So doctors, if they're saying this is near the anterior cubital fossa, you might have diagnosed this already. If you see this petechiae in that area, this is the fever known as dengue fever. So this becomes the diagnosis of dengue fever, right? See, because the platelets are decreasing, now there is more risk of bleeding. So when you are taking blood pressure, right? So that's the time what could happen is, here's where you will start seeing the spots called as petechiae, which is known as positive tourniquet test. If you see this test, it becomes straight away the diagnosis of dengue fever virus. Now what you should be knowing here is, dengue fever virus, doctors, as we know, it is spread by the mosquito called as Aedes mosquito, right? So this guy is spread by the Aedes mosquito. Next, there is a very special concept associated over here. And that special concept is, see, generally if we think about this, Antibodies were made in our body to protect humans from organisms. Let's just repeat that. I hope everybody is with me. Antibodies are supposed to protect humans from the invaders. Rather, in this scenario, what is happening is our antibodies are actually protecting the invader. They are protecting the enemy. We don't exactly understand the reason, but this is what they're doing. Because our antibodies are giving shelter to this virus, now this virus can actually cause the disease in more serious fashion. So this concept is known as ADE, antibody dependent enhancement. This is simply called as antibody dependent enhancement because our antibodies enhanced the disease. And we know the enhanced form of disease comes in the form of dengue hemorrhagic fever and dengue shock syndrome. Okay, hemorrhage would happen obviously because the platelets are decreasing, you will bleed, and the bleeding is simply called as hemorrhage. So dengue hemorrhagic fever and dengue shock syndrome. So I hope all these words are okay with everybody. This is your dengue fever, right? Positive tourniquet test. Now comes the next question for all of you. All of the following are false about exotoxin except. See the language of questions, you have to read very carefully what the examiner is asking. Please don't go by the wording some things that you may know because our mind is very quickly tempted and tricked to actually choose something which you may just know. Right? So first read the question, especially words like not, except, false, etc., so that you get the correct answer. So all of the following things are false about the exotoxin except. Okay, so doctors, the correct answer for this is this. See, what is the translation of the question? They are asking what is true about exotoxin. All of the following are false except means what? It means what is true about exotoxin. The correct answer is toxoid can be prepared. So let's just try and understand something here. See, let me just draw two bacteria, just a rough outline. Assume this is a gram positive bacteria, assume this is a gram negative bacteria. The thing that you need to all know is both gram positive and gram negatives, they can produce one toxin. That means both of them has ability to produce this toxin which is secreted outside the bacteria. Hence the name is exo. Exo means outside. So this toxin is secreted outside. Now on contrary, there's one more thing that is special with gram negative. Gram negatives hold one toxin in their cell wall. Especially in the outer membrane of their cell wall, there is one toxin present. Since it's inside the cell, we call it as endotoxin. Now, I'm going to give you a second to process this once I say this statement. All of you have a look. Can we all agree that the gram-negative bacteria are producing exotoxin also, endotoxin also? Yes. That means gram-negative bacteria, they are producing both toxins, whereas the gram positives are producing only exotoxin. Just have a look at that picture. Now, once you understood this, what we can do, exotoxin can be collected because it's secreted outside, it's more easier to collect. Once you collect this toxin, thankfully, it becomes weak by heating. So we call it as heat labile, right? Or heat sensitive. Exotoxin becomes weaker. So it becomes a weak toxin after you heat it. And the purpose of weakening this toxin is because we want to make a vaccine out of it. And we all know the vaccines which contain the antigen known as toxin, it is known as toxoid. So technically the toxoid are produced by which organism right now, doctors? It is produced by the exotoxin. So let us go back, have a look here. See, most probably I have discussed all points except a thing or two. Now the first point, all are false about exotoxin. That means 3 points are wrong, 1 point is correct. Is it LPS in nature? No. Exotoxin is actually protein in nature. Exotoxins are protein in nature. LPS is endotoxin. Is it produced only by gram-negative exotoxin? No, you just saw the picture. It's produced by both gram-positive also, gram-negative also. Is it heat stable? No, rather it is heat labile or heat sensitive. That means 3 points are wrong about this. The only thing that is correct is the 4th point. That's why we said toxoid can be prepared. Done? So that's about this question right here. Yes, the example for this can be tetanus toxoid, DTP, right? All this comes under the example of the toxoids, right? Chaliye sir. Now, we need to come to this, a very important topic that they very frequently keep asking in your exam, right? Tinea infections. By the way, I would suggest guys, like, what you should do is once this session is over, I would like all of you to even watch the previous session that I have uploaded, because see, something when I said is important doesn't mean it keeps changing in session to session, right? So some topics remain important. So some things I have discussed in that, you can always watch it at 2x speed and then save your time also. Okay, so do watch the previous videos because they also contains quite important stuffs, right? That's just my request. You can just type, Dr. Salman microbiology in MIST and then you will get all those videos. Chalo. Next, talking about false about epidermophyton. Okay, false about epidermophyton. Now, to actually talk about this, what we will do is, before we answer this question, let us discuss a thing or two about the tinea infections. Now, in the tinea are also called as dermatophyte infection. So, derma word aa gaya, meaning skin has to be involved, and they are also called as ringworm infections. Okay. Now, there's a type of tinea called as tinea versicolor, which is caused by a fungus called as Malassezia furfur, and it produces one appearance called as spaghetti and meatball appearance. On 10% potassium hydroxide, what is the appearance of Malassezia furfur? Spaghetti and meatball. So that's a very important question. Upcoming to these things. Now, technically, based on the tissue involved, etc., what you should be knowing is there are 3 guys, one called as trichophyton. Trichophyton is one of the types. Next, we may know the second dude as such, what we call as the epidermophyton. So I'm just going to put it here. Next one we can call as epidermophyton. And third is called as microsporum. Okay, microsporum. So trichophyton, epidermophyton and microsporum. So सबसे पहले one important MCQ you need to learn right here is this. What tissues are involved by which guy? So let us go ahead. See, tri, there's a reason I wrote only that word in trichophyton. Tri means 3. And the maximum number of tissues that these trichophyton, this tinea can involve is 3 tissues only. What are they? See, to make it simple, can we all agree since dermatophyte is the name, skin has to be involved in all the 3? I hope yes, right? So skin to involved hoga hi hoga. Now when I said tri, what else is involved? Skin, hair and nail. Skin, hair and nail are involved by trichophyton. Now, just as a remembering sake, what we are going to do is, this you should imagine as a epiderm, the outermost layer. What is your epiderm now? Skin and nail. So, you will get your second combo right here. Skin and nail is epidermophyton. And then you have microsporum. Microsporum, my dear friends, it is simply going to involve skin and hair. This is your first thing. Okay. Now, once you know this point, what we will do is, we will talk about 2 structures called as microconidae and macroconidae. Okay, so microconidae and macroconidae. Think about it this way. Micro means small. Something is small, microconidae. So because they are small, what we will do is we will look at their numbers, right? For the microconidae, we are going to look at their numbers. Macroconidia are big enough, so we are going to look for their shapes. So for macroconidia, you need to memorize the shape. For microconidia, you need to know the numbers. And this is probably the best time to learn these things because it's a volatile thing. Learn it just before exam. I don't mind if you forget it after this. So look, microconidia and macroconidia, what do you need to do? Let's start here. We will say one statement. Microconidae are micro in microsporum. I know it sounds like a tongue twister. I'll say that again. Microconidae are micro meaning less or few in which guy? Microsporum. तो ये statement खत्म हो गया. This guy is less. Next, this microconidae, they are absent in epidermophyton. They are absent in epidermophyton and they are quite a lot. That means they are abundant. They are abundant in this trichophyton. So, ठीक है, everybody start with that statement. Microconidae are micro in microsporum, meaning they are less in this. And finally speaking, what is more expected as a question is the macroconidae shape. So let's keep this in mind. For remembering the microconidae, right, we will imagine that we are drug abusers, right? We are using some illicit drugs and we went on a trip, right? We went on a trip by using this illicit drugs. And guys, you should know when you go on a good trip, you're going to say, wow, that was epic. So हम क्या करेंगे? We will remember it like this. Epidermophyton has club-shaped macroconidae. ठीक है? Everybody got this? So what is the word epic? Epidermophyton is going to have what shape? Club shape. That's your epic. Now the word trip. What is the word trip going to be? TRI for trichophyton. This is going to be pencil shaped. Right? So trip. Epic trip याद कर लो यहाँ पे. Epidermophyton is club shape, trichophyton is pencil shape. अब बचा एक ही, that will be left spindle shape. If it comes, you know it's not one of the two. So that means you can easily answer this question. See, I know these are, raw facts, but again, you want to score an exam, 1 mark right there. If you just remember this hints, I hope you can answer. So once you have all these points in your head, now let's go back to the question. I will give you one more chance to read this quickly. They are asking false about epidermophyton. That means 3 points are true. 3 points are true. One thing is false here. So first thing, does it involve hair and nail? Yes, epidermophyton, I told you, it involves hair and nail. This is correct. Microconidae are absent. Yes, microconidae are micro in microsporum, meaning they are less in microsporum and they are abundant in trichophyton. तो फिर इनके अंदर absent हो गए. So this is also correct. Next, it causes superficial infection. Yes, tinea infections are the skin infection, derma infections meaning they are superficial. अब बचा एक ही point. Epic trip, epic mnemonic क्या था? Epidermophyton should be having what shape? Club shaped. तो ये pencil shape नहीं हो सकता. That means this is the wrong option. And that's what they asked. What is false about epidermophyton? It is not pencil shaped. It is club shaped. Okay. I have hopefully, hammered this important point in your head now and you will not forget. Okay. So that's it. Let's go to our next question, Doc Sahab. Okay. So here you go. Read the question properly. Arrange the following in order of being least to most resistant. That means the last organism should be more resistant. Okay. Okay. I think there is a mistake in this question. Let me just correct that. It will be opposite, guys. It is actually most to least resistant. Okay, who's the most resistant to least resistant? Sorry about that. So please rechange your answers. Have a look at this once again. Who's most resistant, then least resistant. You have to go in that order. Okay, so hopefully you have chosen some answer here. And the correct option for this question is this. So in the entire microbiology, prions are the most resistant. Okay, you know the word prion. Prions are simply proteins. Prions are simply proteins. So these guys are the most resistant of all. This is followed by the spores and this is going to be followed by the other guys. And सबसे जो weak होते हैं more or less they are going to be enveloped viruses. See, as per logic, envelope viruses sound like they should be more resistant because they have extra layer called envelope, but they are not. Envelope viruses are relatively weaker viruses. Okay, they are going to be weaker viruses. So now what I am going to show you here is this. Some things you need to know if the exam asks you. Okay, they are resistant, you have learned that. Prions are the most resistant. Okay, now let's go. Spores, how can we kill? Okay, how can we kill the spores? This is all I'm saying right now. Sporicidal agents. Sporicidal agents. Now, we are going to do one thing in the sporicidal agents. We will just write the word EFGH agar hai, so you can kill somebody. And who can you kill? You can kill the spores. Agar EFGH hai, so that means we are all good. We can kill the spores also. So what comes under EFGH hai? Okay. The E stands for a gas, what we call as gaseous sterilization, ethylene oxide. ETO stands for the ethylene oxide. The next two are the aldehydes, formaldehyde and glutaraldehyde. Formaldehyde and the glutaraldehyde. So these are the next two things. And in fact, all the three, they come in high level disinfectant. And as per the logic, I believe everybody should understand, why do you call something as a high level disinfectant? Because it can kill pretty much everything, right? High level disinfectants are called so because they can kill everything. So ये सब चीजें हो गई. Now what is in the H over here? The H stands for H2O2, hydrogen peroxide. Hydrogen peroxide. So these are all the chemicals that you needed to know that we can use for killing spores, right? So sporicidal agents are these. Then what are some procedures we can do to actually kill the spores? The H stands for hot air oven, right? Hot air oven, you should be knowing. This is something we can use to kill spores. The pressure cooker you may all know about, called as autoclave. Autoclave can also be used here. And when you burn something, it's called as incineration. So third thing that we can use here, it is going to be incineration. Incineration. So this is our mnemonic. Alright, so let's start from here. क्या याद रखना है? Who are one of the most resistant? Prions. I'll tell you how to kill prions also. First, I am saying sporicidal agents. It is EFGH agar hai, so that means you are safe. You can kill the spores also. And most of them, they belong to the high or intermediate level, which can kill pretty much everything. Okay, so that's about sporicidal agents. Next, what we will see here is, we will see the agents that are basically used to kill the prions, right? So the next in the list, we will see how exactly can we kill the prions. Now for prions, one of the things we can use is, as usual, autoclave. We can use the autoclave to kill the prions. But you should know one difference here. Normally for the autoclave, how much is the temperature and the time for this? Okay, see, the thing is, if you're talking normally about the autoclave, the temperature is 121 degrees for 15 minutes and the pressure is also 15. तो कितनी देर करते हैं autoclave? Only for 15 minutes. And इसका भी purpose समझते हैं. Let's try to understand. Hot air oven, look at the name, it is hot. The temperature is very hot, it is 160 degrees, that too for 2 hours. So hot air oven mein the temperature is also high, 160, and the duration is also high, that is 2 hours. Not every organism can survive this much, right? I'm sorry, not every object we want to sterilize can survive this high temperature. So the substances we want to sterilize, if something is not going to, withstand that high temperature, what we do is we bring down the temperature. And that is the purpose of autoclave. Autoclave is used for those substances which cannot be sterilized by hot air oven. तो हमने temperature कम कर दिया. How much did we decrease the temperature to? 121 degrees for 15 minutes. Right? See, this goes exactly like how we cook foods. Normally we cook the food at a normal, in a normal vessel. It will take more time and you will have to keep the heat also higher. Yes, it will take 2 hours, let's say, to cook a normal dish. Whereas, if you want to quickly make something, we use pressure cooker. So pressure cooker mein what is the extra thing? There is pressure. So same thing autoclave. Because we are, including pressure as a parameter, the temperature has gone down. तो ये normally autoclave के लिए होता है. But now, when we are talking about somebody who's very resistant called as prions, this will not be enough. That means the temperature 121 cannot be enough. So I will increase the temperature in autoclave to 134 degree, and that too not for 15 minutes. I will increase the duration to 1 to 1.5 hour. Prions है sir ji. Prions will not die so easily. So you need to sterilize for a long time. It is at least for 1 to 1.5 hour. Done? This was autoclave. Now next point I can use here is 1% sodium hydroxide. So this thing when I'm using, please know this you have to use for how much time? At least 1 hour. And the third thing, we can use 0.5% sodium hypochlorite. We can also use sodium hypochlorite. Anything what I'm using for prions, the duration has to be higher. Sabse pehle ye rakh lo, right? Whoever it is we are using for prion, the duration of sterilization has to be higher. 1% sodium, 0.5% hypochlorite, we have to sterilize for at least 2 hours. तो सारों में देखना at least 1 hour we are sterilizing the things. So prions being most resistant, we have to sterilize for a longer duration. What was the earlier thing for the autoclave? Only 121 degrees. So that's about it. Also in the sterilization chapter, you should look at 1 or 2 things like the temperatures and stuff. Next, who do we use for, the spills in the laboratory, etc.? We use 1% sodium hypochlorite. The fumigation of operation theater, we will use formaldehyde. High level disinfections we have to use in something where the risk is higher. See, when we want to perform a surgery on someone, we need to sterilize the operation theater, right? Because the person otherwise can get very serious infections and die. So for that, don't take the risk of using some kind of a, sterilization agent. Please always use a high level disinfectant. Example, aldehyde, formaldehyde, etc. So that's it. Hopefully this question is clear enough to everyone. Prions सबसे strong होते हैं. Okay. Now let's go. This is easy peasy. I bet you all can answer this. Acha, you guys are saying this thing? Okay. What is the thing with this question? I don't understand. In the previous question, somebody said something is wrong. The question asked what is wrong about epidermophyton. So other 3 things has to be correct now. So epidermophyton involves skin, hair and nail it gave. Oh, that's the thing. Skin and nail. Sorry about that, guys. If that's the thing that you're saying, I hope you understood the point there. Yes, the option is skin and nail. Okay, thanks for correcting. Chalo. So I brought you back to the same question. When a bacteriophage is involved in causing the gene transfer, it is known as what? Right? So सबसे पहले, who is a bacteriophage? Bacteriophage is a virus. Bacteriophage is simply a virus. Okay. Now, coming to this, how exactly do the bacteria share the genes so that the other bacteria can become resistant to our drugs, etc. Right? So that's the question that they are asking here. So first, what is transformation? Transformation is that process where assume this is bacteria number 1 and bacteria number 2. bacteria number 1, let's say it possesses certain genes, etc., that contains information how to escape the antibiotics that human beings made. That means bacteria are saying to each other, dude, you want to escape the antibiotic? I have that knowledge. And they are sharing that info with each other, right? So what happens is, one fine day, this bacteria has to die. Everybody dies, right? So this bacteria number 1 had died, and now what has happened is there is naked DNA or the genes, etc., that are in the environment right now. So when you have this naked things lying around in the environment, now the second bacteria can simply come near this and acquire this info. This is called as transformation. Transformation is one bacteria has to die, releasing the info into the environment, and the other bacteria will catch that. Okay. Next, what is the second way bacteria can actually exchange information? It is by conjugation. It is by something what we call as conjugation. So what exactly is conjugation, Dr. Saab? See, straight away when you hear the word conjugation, say that conjugation tube has to be formed. Okay. Now this is something happening between male and the female bacteria. How exactly does it happen? There is a male bacteria who's also called as F plus bacteria, and there is a female bacteria who's also called as F minus. F stands for fertility factor. Okay. So if I draw a picture simply put here, what happens is the male contains one structure called as pilus. Okay, it's like the genitalia of the bacteria, you can assume that. So it is a pilus. What happens is this bacteria who's a male come near the female like this. And now you can see a connection is formed called as conjugation tube. And through this conjugation tube, imagine this is the gene. This gene would be transferred like this through the conjugation tube to the other organism. And that's how the information has been changed. So simply put, you see the word conjugation, you should know it is the conjugation tube, right? Now last and the final thing, okay? So I'm just writing conjugation is by the conjugation tube between male and female, okay? Male and the female. Third, transduction. Now how is the information being exchanged in this is, there is a bacteria number 1, there is a bacteria number 2 as usual. Now, in between, there is a virus that is involved called by the name of bacteriophage. What the bacteriophage is doing, it is initially infecting the first bacteria as you see here. From here, this virus called bacteriophage goes into the other, and while it goes from one to the other, it takes some information like this. That means the information is transferred with the help of this virus or a bacteriophage. And one more word you should relate here properly and remember is, when the viruses called as bacteriophages are involved in the cycle, they are performing this cycle called as lysogenic cycle. This word please associate with this thing called as transduction. Lysogenic cycle is happening by the bacteriophage. Okay, so one word to define this, right? Everything comes down to this one words now. This is by the bacteriophage. Translocation doesn't come in this. Translocation is one of the processes that happens in translation, making proteins. When you want to make the protein, remember there is something called as start codon, stop codon. In between, translocation happens, meaning it is protein synthesis, which is not a thing here. So technically, अब question ने क्या पूछा था? What did the question ask you? Question had asked you, who is the guy? I mean, what is the definition when the virus or the bacteriophage is involved? I believe everybody got it. It is transduction. Okay, so that would be the correct answer to this. Okay, this is going to be easy. Just a brush up of antibodies. Antibodies producing opsonization, meaning they coat the antigens, and activating something called as classical complement pathway. What are these guys? That's the question asking you. And the pair that you need to remember for both these functions, it is IgG and IgM. Okay, very good guys. Correct answer is coming up. It is IgG and IgM. So technically, they activate classical complement pathway and they do opsonization. चलिए, amongst the immunotopic, antibodies is one such topic where questions come routinely. So why not just quickly brush up couple of things here. See, one thing is antibodies will have something of this sort, what we call as the heavy chain and the light chain. The logic behind this is the one which is small in size will obviously be lighter in weight also, and something that is big will always be heavier. So based on that theory, can I comfortably say this has to be the heavy chain? Yes or no? Okay, so this is the heavy chain. Now the yellow ones are the light chains as such. Now next point. Heavy chains have some names like gamma or alpha or mu or epsilon or delta, right? Depending on what the heavy chain is in the respective antibody, I will start giving it names like IgG, G for gamma, A for alpha, M for mu, E for epsilon, D for the delta. Meaning if you want to call something as IgG, the heavy chain should be made up of what? Gamma chain. If you want to call something as IgM, the mu chain has to be present. तो ये समझ आ गया? On what basis do we classify the antibodies? The varieties of antibodies, what we call as classes in immunology, are based on the heavy chains. Okay? Next, what you should be knowing here is the upper part in the antibody is known as the Fab, where the antigens bind. Hence, it's called as antigen binding site, which is made up of, as you can see, one heavy chain and one light chain. Whereas if you see the bottom area, it's called as the FC. FC. This is the area where some cells can bind. So cell binding site. This is what we call it as, right? Cell binding site. Okay. And these are also defined as the variable and the constant region. Now take a guess how to easily remember constant region kaun sa hoga isme? It would be the C. C for constant region, which is known as the variable region in the antibody. It is the upper area. The same C you can memorize for one more thing, right? Here's where the complement system can also bind. So cells can also bind here, complement system can also bind at the bottom part of antibody. And C for this defines the constant region in a antibody. So ये था structure, just basic things. Okay. Now next, coming down to some important points related to antibodies. See, the only antibody to cross placenta is the one which is small in size, so it can easily squeeze through the placenta. That is IgG. Only IgG crosses placenta, none of the others. So who's the largest antibody of all? It is M for mega. Mega means big. IgM is the biggest antibody. So the weight is also high, right? Heaviest molecular weight is for the IgM antibody. Now what is the reason IgM is so big? It is the structure. Have a look at IgM. IgM is not one single antibody. It is 5 antibodies existing as one. That's why we call the IgM as a pentamer. Penta means 5. Penta means 5. Right? So that's why this is the largest antibody. And guys, if you see how many binding sites are available called as valency, you can see altogether there are 10 binding sites. So how much is the valency of this IgM? It is supposed to be 10. And look at the next antibody which is present in the human secretions like nasal secretion. It is IgA. IgA is existing as a dimer, and for that reason it should have a valency of 4. So largest antibody is IgM followed by the IgA. Remaining all antibodies exist as a one single antibody called as monomer. Okay. Out of all antibodies, the only heat sensitive antibody is IgE. I repeat, heat labile or heat sensitive antibody, it is going to be IgE, E for elephant. That's all about it. Some important aspects of the antibodies. I'm just trying my best to cover up the most important things so that you can just, reread those things and you can quickly pick up those points. Chalo, that's all about this thing. Next is something I know you study in multiple subjects. So you will have to choose the correct option from this. Acha. Okay. So guys, thanks for correcting. IgG and IgM, I told you initially only, na? IgM and the IgG are the ones that activates opsonization and classical complement pathway. Okay. That's because I deleted the whole thing. I might have just marked that. Okay. Now, match the following when we talk about that. The correct answer here is the option D. Okay. One word. Let's remember these things. Okay. So when you talk about the autograft, autograft is something that is happening in the same person, right? Skin grafts, for example. You're taking the skin patch from one part of the body, putting it somewhere else. That is called as a autograft. That means the first one has to be number 4. So is there any option with A as the number 4? Yes, the fourth option. Let's, just confirm the others also. Xenograft is a different species, right? So the key word here is different species. So that means B has to be number 2. Yes, you can see B is number 2. Next, third one, allograft. What is a allograft? Allograft is between the same species. Yes or no? This is the thing. Allograft is between the same species, and that's why it is most transplant. Same species means between human and a human. For example, I am taking someone's kidney. Somebody donated a kidney. I am taking that. So this would be called as what? Allograft. It's from one human to the other. And last and the final, isograft, it is happening only between monozygotic twins. Okay, it has to happen between monozygotic twins. So as simple as that, these are just one-liners. If they give you any of this definition, you should be ready by this. So let's re-revise. Autograft, same person. Xenograft, different species. Allograft, same species. Isograft, monozygotic twins. So that's why the correct answer was this thing. Okay. Now we are moving to the next question in the list here. The following culture media is used for the culture of which organism? Okay. Now this is something quite eye-catchy, as you can see multiple colors in this. Okay. So this you need to learn. This you need to learn for sure. Please try to understand something. If you're seeing the color, if you're seeing so many colors, logically this is simply called as chromagar. Okay. And I know this is asked more common in the NEET PG, INI-SET, etc. Phir bhi let's get ready if they ask you this question. Chromagar, this is the one that is used for candida. This test not only tells you that this is candida, the reason different colors are coming, okay? The reason different colors are coming, it's because of the different species here. So this not only tell you it is this, it also tells you which species of candida it is. See, Candida albicans is the most common species everybody know. Alba means white, so everything is white about, Candida, cheese or curd-like lesion. Baki, the other things, there are other species like Glabrata, Crucii, Tropicalis, etc. And we know some of them do not respond to the drugs called as conazoles, what we use for fungi. Okay, so Candida albicans, yes, we can use a conazole drug, fluconazole. But we are saying that for the other species of Candida, they may not respond to this medicines we use called as conazoles. So we have to use another antifungal for them, right? So इसके लिए हमें क्या करना पड़ता है? We need to identify the species. And how exactly can we identify species? One thing what I'm saying is we have to use this chromagar. If you see this greenish color is albicans most of the time. Greenish kind of a color is albicans. This pinkish kind of shades is Crucii, etc. Anyway, you don't need to go into that details. Just remember this is for species. Another test that we can do to identify the species if it is albicans or not, there is a test what we call as germ tube test. For Candida, there is a test by the name of germ tube test, also called as Reynolds Broad phenomenon. Okay, it is called by the name of Reynolds Broad phenomenon, in which you see the Candida appearing in this shape like this. Okay, you will see them appearing in this fashion, that is known as the germ tube. They form one special structure, and that special structure called germ tube is formed much faster by albicans compared to other species. See, the whole idea, why do I want to know who is the organism, etc.? Because I want to treat that guy. And sometimes some antibiotic may work for some and it may not work for the others. So that's why in the Candida species itself, the problem is fluconazole can be used for albicans, but it's difficult for the other species. So yes, from the patient sample, even if you suspect it's Candida, we want to make sure we know which species it is, for which we use chromagar or the germ tube test. Okay, so this might be a learning lesson for all of us. Ye colorful dikhte hi, please remember Candida. Okay, so that's about it, Doctor. Next, this is another question that you have now. A bit of a lengthy question, but you have the time to read this thing properly. Okay, so answers look all over the place between B and D mostly. Some are writing 3 Bs, blood-brain barrier probably. Okay, so let's try and learn this. Let's get ready. सबसे पहले, first of all, let's try to diagnose what they're talking, right? It's a diarrhea, all right? Now, the person was somewhere, blah, blah, blah. He ate a lot of food. Obviously, diarrhea comes by eating contaminated food only. That's not a big deal. Sample was collected because that's where the micro question begins from, right? Sample was collected. It revealed dash color, pink color on which stain? Gram stain. Who is the guys who appear pink on the gram stain? Gram negative organism. So it's a gram negative organism. It is comma shape. Guys, comma shape though they have been teaching us since school only, right? Comma shaped organisms are Vibrio. So this is nothing but your Vibrio cholera. So now the question comes, once you know it is Vibrio cholera, how does the cholera toxin works? Right? So please try to understand this. This is the Vibrio cholera. Chalo. So the correct answer will come down to it increases cyclic AMP. Okay, it increases cyclic AMP. Now let me just tell you something over here. Abhi gaur se sunna everybody. Please all of you look at this point what I'm telling you next. So sir, let's say this is cholera toxin. Okay, and this is the lumen of your GIT. That means you ate something, the organism came inside. This guy, the toxin is inside right now. This is known as what? Cholera toxin. Now, cholera toxin will have two factors, okay, as such, A and B. Okay, two fragments basically. These are two peptides or the protein fragments that are present in this toxin. अब हमारे intestine पे, on our intestine, Dr. Saab, what is present is the mucosal surfaces. Yes or no? What would be present here would be the mucosal surfaces. So what you need to as such understand is, first of all, how does this toxin work here? This guy bind to some receptors. That means cholera toxin has to bind to some receptors. Thoda sa, I will teach you like this. So first learn who is present over here is a receptor called as GM1 ganglioside receptors, right, on the surface of our epithelium, mucosal epithelium or intestinal epithelium, what is the receptor that is present? GM1 ganglioside receptor. Okay? So easy, how to remember this? The B binds, B for the binds. So which part of the cholera toxin first binds to this receptor GM1 ganglioside? It is the B fragment. तो पहले bind हो गया. Now what happens is, because the B is bound, it will allow the A to come inside now. Now बात समझ आइए. सबसे पहले who will bind there? The B will bind. Which receptor will it bind to? GM1 ganglioside receptor. And then who will come inside? A fragment of this toxin. और A active है, मतलब the thing that is done, that is the disease called as cholera that presents the watery diarrhea, it is because of the A for the active. अब करते क्या है ये भाई साहब? This guy causes ADP ribosylation of G protein. So this concept you should know, everybody. ADP ribosylation of G protein, which increases one enzyme called as adenylate cyclase. Okay, what is this going to do is, it is going to increase this enzyme, what we simply call by the name of adenylate cyclase. Okay, adenylate cyclase जैसे ही बढ़ेगा, this in turn will increase a substance called as cyclic AMP. And this leads to what is, it decreases absorption of sodium also, chloride also. Meaning from the lumen, जब sodium and chloride अंदर आने होते हैं, they are supposed to come inside, they will not be absorbed. Meaning where will sodium and chloride increase now? In the lumen. And you all know, wherever sodium goes, water will follow. In other words, who will increase in the lumen now? Water. And this would be excreted out. चलिए इसको फिर से restart करते हैं. Everybody, let's try and understand this. I am just teaching you how does cholera toxin work. One word में, if you want to describe, it increases cyclic AMP, which causes decrease in absorption of sodium and the chloride. So in other word, it increases sodium chloride excretion, which leads to a watery diarrhea. Okay? कैसे होता है? There are two fragments in cholera toxin, A and B. B will bind first. Which receptor will it bind to? GM1 ganglioside receptor. It binds to the GM1 ganglioside receptor. As soon as this B fragment binds here, it allows the entry of the A. A is the active guy, right? And what does this active guy do? It increases adenylate cyclase, which in return increases cyclic AMP. And whenever cyclic AMP increases in the GIT, what is going to happen is there would be loss of the sodium chloride, etc., which leads to loss of water. So which diarrhea will happen? That is the answer here, right? Watery diarrhea. And we all know cholera presents as rice watery stools. Yes or no, doctors? So this is the idea you need to have with this. Abhi, I'm going to give you one mnemonic. God say, please everybody look here. I said increasing the cyclic AMP causes watery diarrhea. It causes the watery diarrhea. So see here all of you. सबसे पहले C से हम क्या करेंगे? We will remember cholera toxin. Cholera toxin increases cyclic AMP, causing watery diarrhea. Next we'll remember A for anthracis toxin or anthrax toxin. Anthrax toxin will cause edema. Water से ही related है. One is a watery diarrhea, one is a edema. Next, same way P for pertussis you should remember, which can also cause edema. And the only one left is this. I know doesn't go by my mnemonic, but M को हम ऐसे याद रखने वाले हैं E की तरह. So we are going to remember the M in the cyclic AMP as the E, and you should remember E-tech here. T for T, it's the most common cause of traveler's diarrhea, right? This is the most common cause of traveler's diarrhea. And doctors, pay attention. Cyclic AMP increase is either causing watery diarrhea or a edema. Who are the two guys causing watery diarrhea right now? E-tech and cholera. Who are the two guys causing the edema? Pertussis and anthrax. So that's about it. This would be the correct answer here. Yes, good job guys. You know, it shows the darting motility, etc. And in fact, we had a question a while ago. Cholera ka ye jo toxin tha, right? If you remember, this was called as the TCBS. This question. Remember, this was the TCBS for Vibrio cholera. You should know the transport media also for the cholera called as Venkatrama Ramakrishnan, called as VR media, and Carey Blair. So those are the things that you need to know. So we are basically done with that question. Now go ahead with the next question and quickly answer this, please. I hope this is a relatively easier question. All right. So now, hope, my dear friends, you have given your answers. A supervisor of a company that deals with woolen jackets recently developed pulmonary symptoms and that was later diagnosed as a pneumonia. What is the disease that is being mentioned here? Since most of you are giving the correct answer, you may all know they're talking about something called as wool sorter's disease. So this guy being a supervisor, he might be checking a lot of wool, the quality of wool. How is the disease connected here? You know the anthrax disease come through cattle, right? Anthrax disease come through the cattle. Now there are two types of diseases that you can get. See, one is if somebody works for a leather industry, for instance, they are going to be handling the skin of animal. Yes, they're going to be handling the skin of animal. Assume somebody is handling the skin of the cattle and that's the place anthrax can be expected. They can get a skin form of disease, what we call as hide porter's disease, right? We can get this thing, what we call by the name of hide porter's disease. Whereas somebody who's sorting the wool, they will get, the other form called as wool sorter's disease, which comes by inhalation of spores of anthrax. So this disease comes by inhalation of spores. So up question comes when you inhale something, obviously it goes to the lungs, so it will cause a pulmonary disease, which is a pneumonia, right? So up question once you diagnose this is anthrax, what are the things here? Does it have bamboo stick appearance? Yes, it does. You know, these rod-shaped organisms, they stack on top of each other. That gives you this kind of a bamboo stick appearance. In the gelatin stab, right? Stab means they go more deep inside. They produce that inverted Christmas tree appearance, right? String of pearl is also produced. The only thing that is not produced by them is carom coin colonies. So you guys were correct in this. Carom coin colonies, it is a feature of Streptococcus pneumoniae. Streptococcus pneumoniae produces that carom coin colonies. All right, doctors. So that's it. This is all is your answer. No couple of important points. This is the only guy, that is Bacillus anthracis, whose capsule is made up of protein, unlike the other organisms whose capsule is made up of lipopolysaccharide. Okay, did I emphasize enough on this? This is the only guy to have a protein capsule, and for this it has a special test what we call as McFadden's reaction. Okay, so that's about it that you need to know. So this is your next question. So they're just asking you, this picture, I'm sure you're all familiar. This disease has to be diagnosed as diphtheria because of that pseudomembrane, what you're seeing in this, right? So this is the diphtheria you need to know. Now, diphtheria disease, it is a toxemia, right? You need to know diphtheria disease, it is a toxemia, meaning the toxin actually produces the disease. Now, you should know how does the toxin of diphtheria works. It inhibits protein synthesis by a mechanism. How does it work? It blocks elongation factor 2. Okay, so by damaging the elongation factor 2, it inhibits the protein synthesis in human beings. Okay, so if the polypeptide chain cannot elongate, then the protein synthesis is, going to stop. The next point comes down to this. The disease, since it's not directly by the diphtheria organism, but rather due to its toxin, we need to run a test to, check if the strain of the diphtheria coming from the patient sample, is it producing toxin or not. And this is done by one test, what we call as ELEX test. So ELEX test is for the toxin of diphtheria, is done for the toxin of diphtheria. Schick's test also is done for diphtheria, but not for this. Schick's test is done to check should this person be given the vaccine for diphtheria or not. That too, it's not done anymore. This was done back in the day when the vaccines were less. When the vaccines of diphtheria were less, so they used to check the immune status of a person, and only those people who really need the vaccine, they were given that. And that test for checking the immune status was called as Schick's test. Okay, nowadays DTP vaccine is easily available. We don't have to do anything of this sort. Naegler's reaction also is a test for the toxin, but not for this guy, Clostridium perfringens. This is a test done for the Clostridium perfringens toxin, the one who causes gas gangrene, right? So that also is a test for the toxin as such. So I hope everybody got this correct. This was an easier question for sure. Chaliye Doc Sahab. Now you have the next question right here in front of you. Which of the following colors represents marker of hepatitis B is the Australian antigen? So let's go. Now this is our next question. Read the question properly what they are just asking you. In other words, they're asking who amongst this picture is the Australian antigen. सबसे पहले you all need to know which color is the Australian antigen. I'm going to zoom in properly so that you choose the correct answer. Purple, green, orange and blue. These are the colors that you are seeing here most probably. Okay. Now listen to what the question had asked you. Question has asked who is Australian antigen? Who is Australian antigen? See, first of all, as a raw fact, you should know who's called as the Australian antigen. Guys, it is HBS antigen. Since this antigen was initially found in the aborigines of Australia, it was named after them, called as Australian antigen, HBS antigen. You know, this guy marks the disease. HBS antigen marks the presence of the disease called hepatitis B. And एक point हम याद करते हैं, there are two hepatitis which can become chronic now, hepatitis B and hepatitis C. Who amongst this has higher chance of becoming chronic? C for C, chronicity is maximum with C. Hepatitis C has higher chance to become chronic in relation to Hep B. Both of them can become chronic, both of them can cause cirrhosis, both of them can cause liver cancer, but the point is the chances of becoming chronic are higher with Hep C. So on what basis do we decide is this hepatitis B already become chronic or not? See, there are two ways. We need to look for one antibody called as IgG. IgG will represent chronic. That is one way. And second way by which I can identify that this has become a chronic hepatitis B case is if the hepatitis B surface antigen, if it lasts for more than 6 months. If it lasts for more than 6 months, we call it as what? We call it as the, chronic hepatitis. How much is 6 months in weeks? 1 month has 4 weeks. That means it has to be more than 24 weeks. If this antigen does not disappear, even after 24 weeks, that means we can call it as what infection now? We can call it as chronic. So a point here, sir, just keep this points what I'm telling you in your head. If you are wrong, you can revisit this and now tell me the answer. Australian antigen, you know it is HBS antigen. In this picture, how are you going to identify which one is HBS antigen? Just see which antigen came first, because I told you this guy shows that the person is infected with hepatitis B. It is the first marker that we can detect. The first marker to rise in hepatitis B is hepatitis B surface antigen, HBs antigen. And if this guy lasts more than 24 weeks, it's called as chronic. So acute chronic, that's not the point here. You can just see which antigen came first. It is the purple guy. That means it has to be Australian antigen. And it is disappearing by what time? It is disappearing by almost 24 weeks or so. That means this purple color, if you notice, was HBs antigen. After some time of antigen appearing, then the antibodies can come like anti-HBC. So this picture is having anti-HBC. This green is anti-HBC antibody, which can be IgM and IgG. So initially this red is the IgM, later it is IgG. And you can see this blue in this picture, it is anti-HBS. It is the anti-HBS. So you can see when somebody is recovering from hepatitis B infection, their antigen should disappear. Which antigen should disappear? HBs antigen. And within how much time it should disappear? Less than 6 months or less than 24 weeks. And some time later, you will start to form the antibody which tells you that you have recovered, called as anti-HBs. And the period in between here, that is from here to here, it's called as window period, right? You can just imagine the formation of antibodies takes some time now. So before the formation of anti-HBs, this period would be known as window period. Okay. So please notice in the window period which antibody will be present that time, anti-HBC, and the other markers will also be present. But the main guys will be absent in window period. Which guys would be absent in the window period? HBs antigen also and anti-HBs also would be absent. Both of them will not be present as this is the period in this gap we are talking. So ये gap में कौन present है if you look up? It is the HBs anti-HBC antibody. So this guy is present over here. This was the window period and how to interpret this thing as such. I hope this is clear enough to everybody. Okay. So the correct answer, obviously, you know, it is the purple one. That is your Australian antigen. Okay. Go ahead. This is your next question. Which of the following stages of the malarial parasite corresponds with relapse in Plasmodium vivax? Okay, they are asking a question about the stage here. Okay, so chalo, let us begin. Number one, you should know only two species are related to relapse, one called as vivax and another called as ovale. And obviously in India, I am more concerned with vivax because this is the dude found in India. So relapse can happen with this. And now the question is asking which is the forms, which is the form which is associated with relapse. The correct answer to this is hypnozoites. See, the points you should know. When this malarial parasite comes inside human being, okay, when the malarial parasite comes into human being, it comes in the form of sporozoid. So the infective stage, when the mosquito is biting us, it is leaving with stage sporozoid. Then this sporozoid will convert to merozoites, and this merozoids, when they are multiplying in the RBC, right? When the merozoites are multiplying in the RBC, these merozoites, they produce symptoms of malaria. And because they are taking 2 days to rupture this RBC completely, and then the parasites get released into the blood. If you think this is your bloodstream, every 2 days the RBCs will rupture, releasing which forms into the blood? Merozoite. Symptoms of malaria are due to merozoites. So I'm just telling you importance of all stages. Which one came inside? Sporozoid. Which one is for the symptoms of malaria? It is the merozoite. Next, you should know trophozoite also is found inside the RBC, and trophozoite takes up the shape of a ring. So the ring shape, what you get is due to the trophozoite. Let's just think about this. Trophozoite if it is a single ring inside one RBC. Assume this is a RBC and this is one ring, versus this is a RBC and you see multiple rings. By this we can actually differentiate if it is vivax or falciparum. Vivax is going to have that single large ring, whereas falciparum is going to have the multiple rings. So vivax versus falciparum, this is how you can differentiate this. Okay, that is due to which? Trophozoite. So finally they just asked you one thing, who can actually restart malaria called as the relapse? Answer to that is hypnozoite. That's why whenever we treat vivax infection causing malaria, we will have to add certain medicines to kill the hypnozoite stage, which is sleeping in the liver. So the drugs like primaquine or tafenoquine are given here to actually kill this hypnozoite stage, primaquine or the tafenoquine drugs. Okay, so that's about it. Malaria topic you should definitely revise fully because each line there can be important for us. So for this question though, the correct answer would be straightforward, hypnozoites. Okay. So next question right here for you. Okay, so I'm starting to see the answers already. Good job, guys, along with the diagnosis as well. All right, you guys are rocking. So, chalo, first of all, what have they mentioned here is a patient is having difficulty in swallowing and generalized weakness. Okay, abhi tak to I couldn't diagnose this. Physical exam was performed and there was no hyperemia or pharyngeal exudate found. Okay, so there is nothing as such. Difficulty in swallowing was there, so the doctor has opened the mouth, examined, is there some infection in the mouth? Nothing was found in the pharyngeal area. It's not diphtheria, it's not anything. She also complained of diplopia, and on eye exam, ptosis was noticed. Diplopia, ptosis, swallowing difficulty, generalized weakness, now these are all supposed to ring the bell for myasthenia gravis. And how did this question confirm that this is for myasthenia gravis? She feels better with rest. You know, myasthenia patients feel better whenever they rest. So simply put, myasthenia gravis is an example of which hypersensitivity? The answer over here would be type 2. Okay. Now there is one mnemonic. My blood group is Rh positive. Okay. My blood group is Rh positive. Now, what is this mnemonic teaching us? Listen to the words I'm telling you. My for the myasthenia gravis, it's an example of type 2. Anything related to the blood reactions come under type 2. G for the Graves disease. G for the Graves disease. Next, a disease called as ITP, thrombocytopenia, right? Basically, anything with blood, any penia, anything autoimmune hemolytic anemia, anything with blood is type 2. So, thrombocytopenic purpura, if I am saying, thrombocytopenia means again it's a blood thing. So, it has to be type 2. RH is for rheumatic fever, rheumatic fever. And finally, P for the pernicious anemia, pernicious anemia. So, these are the names that come under this list as such. Okay, so type 2 examples are these, and type 2 examples are quite important for examination. Now what we will do is, we will just have a look at couple of things as such you need to know, different hypersensitivities and different points you need to remember with these. Okay, now let's come down to this. Okay, let's come down to this. Type 1 is due to an antibody called as IgE. Type 2 and 3 are due to the IgG as such. Next, type 4. Type 4, it is cell-mediated immunity. That means the only one in all hypersensitivities which is not due to this antibody is this. Cell-mediated immunity is mediated by one of the T helpers called as Th1, whereas antibodies are by Th2. Okay, so the one which is a bit different from all the others, it is the type 4. Okay, now the next thing, this is what you want to know here. See, this guy, whatever you are learning here, 1, 2, 3, 4, let's learn couple of more things. This happens very quickly, it is the fastest, whereas the fourth one is the slowest. It will happen in, days. It will take 2 to 3 days for reaction to happen. That is taking few minutes, this is taking 2 to 3 days to happen. And that gives it the name delayed hypersensitivity. So in the mnemonic called as acid, in the acid, the D is the delayed hypersensitivity. Is that understood? Whereas these two, they happen in few hours, right? They take, some hours for reactions to begin in the body. Now acid word, I'm sure you have learned what does that mean. See, type 1, you need to correspond with the A for the allergy or anaphylaxis. Allergy or anaphylaxis, it would be type 1. Next, cytotoxic is the word. Cytotoxicity is the word. Immune complex deposition. Immune complex deposition, you need to know here. And the D is the delayed. So these words, you all see, you are all familiar with this. Now what I would like to address something over here. In the type 2, just for the mnemonic sake, we have used the word cytotoxicity. So the mechanism for this, it is actually given a name called as ADCC. ADCC. What does this ADCC stands for is antibody dependent cellular toxicity. And what is cell toxicity called as cytotoxic? That's how people memorize it. So in the mnemonic, my blood group is Rh positive. In the mnemonic, my blood group is Rh positive. You should know one thing, my dear friends. Majority of them, there will be damage to cells. There will be damage to the cells happening. And one more process that exists in this, it is known as ADCD. Now what is this ADCD? ADC, these words are same only, antibody dependent cellular, but instead of cytotoxicity, there is a term what we call as dysfunction. Okay, what is this word called as? ADCD stands for dysfunction. So antibody dependent cellular toxicity, ADCC, which is more common, and then you have cellular dysfunction. Look at the word. Why do you think there is a separate word for this? The separate terminology comes because in this hypersensitivity, the organ is not getting damaged. There is no cellular toxicity. Rather, just there is a change in the function. And the only two important examples for the ADCD are myasthenia gravis. One is myasthenia gravis, another is Graves' disease. Okay, myasthenia gravis and the Graves' disease. So basically it is a variant of type 2. Some, guys can mention it as type 5 also because it's a bit different. Technically it is type 2 only. Okay, type 2 hypersensitivity, ADCC or ADCD. Who's more common? Cellular toxicity. That's why the mnemonic goes like this, cytotoxicity. But there is a variant in which there is no damage to the cells, just a change in the function called as dysfunction. Alright, so that's about it. This is your hypersensitivity. And ये जो दोनों special है ना ADCD, dysfunction वाले, they both will have grave in the name. Myasthenia gravis, let's pronounce it like that, and the Graves' disease. Both the special dudes are the one which have the grave in the name. Okay, so this finishes your hypersensitivity revision also, a very high yield topic for exam. Next, the thing boils down to this thing that is quite frequently coming in your examination. So you should definitely throw some light on this. All right, Dr. Saab. So here we go. The disease that mimics the condition shown in the image below. See, I'm not asking you what the disease is. Everybody knows what it is. Right? I'm asking you who resembles this disease. Okay. So now the correct answer to this is, first of all, this is Madurai foot or mycetoma. right? Everybody knows this is Madurai foot or mycetoma. And the infection that resembles mycetoma is called as botryomycosis. It would be simply called as what? Botryomycosis. It is caused by Staph aureus, the superstar of micro called as Staph aureus causes this. This is basically botryomycosis that might look similar to this. Okay, so Madurai foot to sab log pehchante, everybody recognizes this thing. Now, look at a thing or two I would want you to know. Number one, when you talk about mycetoma, you should know there are two guys causing this. If it is fungi causing this, we know it's called as eumycetoma. And if it is bacteria called as actinomyces or nocardia causing this, then it's called as actinomycetoma. See, actinomyces is causing, so it's simply called as actinomycetoma. See, number one, when you do the microscopy, based on size also, it gives us a hint to identify whether it is fungal or bacterial. See, microns, look at the size, it's quite small. Fungi, the hyphae of this fungi, it would be quite bigger. 4 to 5 microns is generally the size. That means they are bigger. The fungal hyphae would appear bigger on microscopy, whereas around 1 micron is the size for the actinomycetoma. It's quite small. Now, other things what you need to see, mycetoma, oma. Oma means swelling, which is called as tumor. It's not a cancer. It's just a swelling. Multiple swellings, if you see in the picture, then that can be bacterial one, whereas the single one is the fungal guy. It does one, but it causes more serious. Let's just repeat. Fungi ek karta hai, it causes one lesion, but it does it well. Bacteria causes multiple, so its severity is divided. It's not as serious. We know, right, out of the two, which one has a better prognosis? Bacterial one, because we can use antibiotics. On contrast to fungi, where we have to do the amputation. You know, right? Fungal mycetoma, basically called as eumycetoma, we need to do amputation. Baki, what do you need to know? Sinuses, if you examine, from which the pus will drain, there are few sinuses, whereas there are multiple. Okay? See, it's just like empty vessels make more noise. Actinomycetoma is like that. Too many, omas, too many sinuses, but thankfully it is more, subtle. It's not as serious. Now, if you talk about the colors, etc., the granules, if you examine, the dark color granules or black are generally fungal in nature. White is generally the bacterial one. Now, there is a bacteria called Actinomyces pelletri. Okay, Actinomyces pelletri, and this is the guy that produces red color. तो आपको ये याद रखना है, pelletri is one of the actinomyces, Actinomyces pelletri. It produces red color. So basically dark color for the fungi and light color for the bacteria. So that finishes your mycetoma overview. Okay? Now, this I believe you can recognize, guys. All right, so here we go. I hope you guys are ready. See, if you actually know this image, most probably you don't even need to read full question. You might have already guessed it. See, some things that might make you choose something else as the answer. For example, fishy odor. Don't just jump to the conclusions. Fishy odor, I know some of you may be thinking Gardnerella whiff test. But notice, whiff test is when you add 10% KOH to the sample, then you get the fishy odor. Here you are just getting directly the fishy odor. That means it's not Gardnerella. Okay? So, number one, this is what I wanted you to know. Now, next, the important point, this infection is diagnosed as trichomonas. Okay, this is actually trichomonas, and what you are seeing is the trophozoite stage of this guy. Okay, so what is special with trichomonas is it doesn't have a cyst. For example, Giardia, Entamoeba, whoever we talked about in diarrheal agents, they have cyst also, trophozoite also, but this guy is one protozoa which does not have a cyst. It only has a trophozoite. And how do you get this? Sexually. It is transmitted sexually, doctors. Okay, so that's one point that you need to know. Now, next thing, this is a disease of discharge. Although when you do colposcopy, etc., you can actually see something called as strawberry cervix. Okay, strawberry cervix. Intense itching is one of the important clinical features here. So is that understood by all of you? It's not bacterial vaginosis because there is a mention of discharge, there's a mention of fishy odor. I know most of you were tempted to choose Gardnerella. Okay, it's not. Itchy and those things what they have described. See, it's a parasite that is given. It's not a clue cell also. That means it cannot be Gardnerella. It is probably one of the most common wrong answer most people would have chosen. Okay, so Trichomonas is the correct one. The STDs that presents with discharge are Trichomonas, okay, chlamydia, gonorrhea, etc. So these guys, they generally produce some kind of a discharge. Okay, now going into the guys that can produce some kind of a lesion, right? They produce some kind of a lesion that we can visualize as such. You know, this is these STDs what you're looking at. Now I have just jotted down the most important STDs. Sabse pehle how we will start is, out of all STDs, if you're seeing something on genitalia, which are the painful guys, only two guys are painful from this. So if you see the word painful, straight away you should rule out everything. Think between the lines, only two guys can do that. Herpes lesions are painful and chancroid is painful. Now chancroid, in our class also we learnt exactly like this. Patients do cry. The organism causing chancroid is which one? Chancroid is by Haemophilus ducreyi. We pronounced it as patients do cry. That means it is painful. Chancroid has a D. That means it is painful. Syphilis on other hand has chancre, which is painless. So ये हमने easily सीखा था. Chancroid and chancre, this is the difference. One is painful, one is painless. Okay, so that's about it. Next, if you see, the other guys are also painless. So technically, if you know chancroid is the painful and herpes is the painful, you're done halfway already. Okay. Now coming to lymphadenopathy. Okay. Now lymphadenopathy, when we talk about here, okay, again we can see the word painful only with these two guys. It's painful here. Lymphadenopathy is painful. Lymphadenopathy is painful. So the guys who are producing the pain, they are painful in both. Ulcer is also that and lymph node is also painful. So done, straightforward. Ab bache three guys. Let's talk about them. They are all painless. Okay, more or less they are going to be painless. Lymphadenopathy. I am going to take you to more important words now. So pay attention. When multiple lymph nodes are involved, they may fuse together, and when they fuse together, they are called as a bubo. Okay, when multiple lymph nodes are involved, they fuse together to form a structure what we call as a bubo. So bubo किस में दिखता है? Let's try to understand this. Now, when we talk about the bubo, the main place where you're going to see the bubo, one is here. Okay, you can see a bubo here. And second, the bubo will be seen here also. तो कौन से दो जगहों पे bubo दिख रहा है guys? Now, unlike the painful word, don't think it is herpes. Bubo, one, it is seen in chancroid. Another place where you see the bubo, it is in the LGV. It is in the LGV that causes genital elephantiasis. Lymphogranuloma venerum, you may know, right? This guy causes what? It causes genital elephantiasis. Now, there are two bubos. One is inguinal lymph node and one formed by the femoral, right? So, two bubos are involved here, one by the inguinal, one by the femoral. So, what ends up happening is because of the big swelling in between these two, there is a line that is formed in between, right? And when you have some space, we call it as a groove, right? So, there is something called as the groove sign, which is important that you should know here. Groove sign is seen with which guy? LGV. And you should know this LGV, the one that is causing the groove sign, it's nothing but the bubo, the space between that. So bubo wale do ho gaye. There is the last point that we will know here, donovanosis. Donovanosis, it forms something by the name of pseudobubo. As the name says, pseudo means false. It's not a true lymph node swelling. If it's not a lymph node swelling, then what it is? Why do I even call it a bubo? It is simply a subcutaneous nodule. It is simply put a subcutaneous nodule. तो चलिए सर जी, how to just go over this topic. STDs are important first of all. That's why I'm discussing all this with you. First, who are the painful lesions presenting wale STDs? It is chancroid and herpes. Chancroid, D for do cry. Patient do cry. That should remind you of the painful lesions. Done. Even the lymph nodes are painful with both chancroid also, herpes also. You talk about bubo. What is a bubo? Bubo is a swelling of the lymph nodes because of coming down together. So bubo किसमें दिखता है? Originally it's seen in chancroid and in LGV. In LGV there is a sign what you see in between called as the groove sign, and pseudo bubo, that is not the original bubo. It is basically subcutaneous nodule that is seen with donovanosis caused by the agent Klebsiella granulomatis. Klebsiella granulomatis, it causes this donovanosis. Okay, so that's it. This was the STD as such you need to know. Okay, so once we are done with the STD, here's your next question. All right, so let us discuss the answer for this. The correct answer, dear friends, it's Ascaris. Okay, number one, even if you don't know all that thing in there, see, this is the power of knowing some images. This is the egg of the parasite called as Ascaris. You need to identify by these bumps that you're seeing on the surface of this egg. ठीक है? तो पहली चीज ये होगी. Now, how do you get this infection? See, in the nematodes topic, that is the roundworms, there are some worms that you can get by ingestion of eggs. And since we are ingesting the eggs accidentally, we are going to use a mnemonic called as EAT for them. And amongst the EAT, two are in the names here, E for enterobius, A for ascaris, and T for the trichuris. Okay, so these are the three parasites here, enterobius, ascaris, and then trichuris. These are the three guys that we get by ingestion of eggs. Now, when it comes to ascaris, what happens is you have ingested the egg. Now, what is going to happen is that these eggs will hatch into the larvae. These eggs, eggs will convert to larva, larvae will convert to adult worm. So, technically, these will convert to larvae, and these larvae will go to the lungs. These larvae will go to the lungs. तो कहाँ जा रहे हैं सर? ये larvae जाएंगे lungs को. That's where they will go. And what they do there is one pneumonia, or this thing what we call as Loeffler's syndrome. Okay, the name given here is Loeffler's syndrome. What is a Loeffler syndrome? It is a pneumonia that is produced by ascaris. तो ये words हम एक साथ याद रख लेंगे. Larvae जाते हैं lungs को, L for the lungs, and they cause one pneumonia in there called as Loeffler syndrome. And what can happen when we cough? In a pneumonia, when we cough, the organisms are gaining, exit from the lungs, and they may go to the GIT once again, where they become adult worms. Are you understanding? कहाँ से आए थे ये लोग? They came as eggs, went to the lungs during the maturation in the form of larvae. Now they might be coughed out, and when you're coughing, they might be again gaining access to your GIT, where they convert to adult worms. And when they become adult worms, they cause problems in the GIT, which can lead to, abdominal discomfort, intussusception, etc. Many things they can do. So the point, doctor, is this. Sabse pehle, what did they describe? They describe the person as having abdominal discomfort. This is by the adult worm. See, before they become adult, they should have gone to the lungs, meaning before the abdominal discomfort, they should have caused some, pulmonary issue. So that's why in the history, what is mentioned? 1 week ago. Roughly 1 week ago, these guys had caused a pulmonary symptom, and now they are causing the GIT symptom. So ये कौन हो गया दोस्तों? This has become the guy called as Ascaris. The correct answer is here. By the way, to learn the other eggs also, I don't want to prolong this session, so please have a look at the other video I have mentioned before. Okay, all the eggs of parasites have been discussed in that. Last question for today. This is the one, doctors, that you need to identify. Okay, so I believe you guys are, pretty much done with your answers. Okay, so what you want to know is this. Okay, this question, more or less, if you see the clinical scenario, it is hinting more towards mucormycosis, and that's why I intentionally put mucormycosis as the first thing. Many of us will start to think, "Arey, nose is mentioned, paranasal sinuses, orbital swelling, etc." So this sounds like that. But if you examine, right, if you examine this, you can very clearly see something. Okay, what is being shown in this picture is, as such, the septate hyphae. Okay, septate hyphae. How do you know? Please look here. You can very clearly see these lines in between. And when you see the septate hyphae with a 45-degree angle, it is aspergillus. A for aspergillus, you turn it around, you get this 45-degree angle. And if you look at the fingers, you will get to see the septae also. So ये A for aspergillus, turn it around, you get a 45-degree with septate hyphae. That's why the answer here is what? It is nothing but this. It is a case of fungal sinusitis, which can be by aspergillus. Okay. So technically, my friends, this would be the end of our session. I hope that this compilation of the most important topics will definitely help you in the exam and to revise these things quickly. Hopefully you like the session. Please comment down below, as they say on the YouTube, right? I will also become a YouTuber. Subscribe, like, and do comments down there. All right. Baki, this would be my best wishes that each one of you who's taking this exam, pass this. You all deserve to pass. Make yourself proud, make the faculties proud, and make your parents proud. All the best from our side. Thank you very much.